War and conflict change everything in seconds. One moment, life is normal, and the next, there's fire, smoke, screams, and fear. In these times, we are not just protecting our homes, we are protecting lives, loved ones, and hope. Burn injuries during such emergencies are tragically common, caused by blasts, fires, broken electric lines, or chemical exposure. And in these moments, medical help might be far away, delayed, or unavailable. That's why your first aid can mean everything. If someone near you suffers a burn, don't panic. Your calm presence is the first medicine. Quickly and carefully remove them from the source of the burn, but only if the area is safe for you too. Step 1. Cool the burn immediately. Use clean, cool water. If you don't have running water, use bottled water, clean cloth soaked in water, or even clean snow if nothing else is available. Cooling the burn for 10 to 15 minutes helps stop the burning process and reduces pain and damage. Do not apply ice, butter, toothpaste, oil, or any home remedies, especially in such dangerous times. These might feel helpful, but they can trap heat or cause infections. Step 2. Cover the burn. Use a clean, dry cloth, sterile bandage, or even a piece of clean cotton cloth if nothing else is around. The goal is to protect the wound from dirt, bacteria, and the environment, especially important when hospitals may be overwhelmed. Step 3. Watch for signs of shock. In war zones, burns are often accompanied by trauma. If the person becomes pale, starts breathing fast, feels cold, or loses consciousness, lay them down gently, raise their legs slightly, and keep them warm with a blanket or coat. Do not give food or water if the burn is severe or the person is unconscious, as surgery may be needed. If the burn is on the face, hands, feet, genitals, or is larger than the palm of the hand, it's considered serious. Seek medical attention as soon as possible, even if it takes time to reach a clinic or aid station. Lastly, offer comfort. Pain is not just physical. In war, emotional wounds often run deeper. Let the person know they are safe, that you're with them, and that help will come. Sometimes, a voice of reassurance is the strongest medicine. In these difficult times, we may feel powerless. But even without medical degrees or big hospitals, your hands, your heart, and your courage can save lives. Let's learn. Let's be prepared. Let's protect each other until peace returns.